Hello, my name's Gillian Robinson and I'm the founder of Healthcare Compliance Solutions. We work with aged care services throughout the whole of New Zealand, providing support for compliance. We also provide the aged care software for clinical management, national benchmarking, and actually a whole range of other things. We've got Rose Kennedy here with us today, who's going to talk with us about the enrolled nurse role within her care facility. We will talk with Colette later, but we'll start off with Rose. And Rose, you're situated in Greymouth on the west coast of the South Island. And can you tell me, just before we get started into the questions that I have for you, how many residents do you have? What's your capacity in your care facility there, Rose?
So we have a capacity for 42 residents, 20 hospital level care, and the rest home.
Okay, so 42 residents there with a mix of hospital and rest home level people. Do you find over time that you're getting more hospital level and less rest home level people?
Yes.
Yeah.
Just starting to show.
Just starting
to show. Numbers, yes.
Yeah, okay. So tell me about your role in aged care prior to your current role, because you're there as the facility nurse manager and you run the service. What was your role before?
So my role was at the DHB. I spent 8 years as an RN in the acute medical and high dependency. And then I went on to spend 9 years as the manager in the same facility ward. So it's quite a change for me coming from acute to aged care, but it's quite enjoyable.
So you talk about that change, and I've heard other people talk about that as well. Can I just ask what was some of the distinct changes? Can you recall?
Well, a different pace for a start off. Probably not. It took a long time to get used to not having a doctor there in the facility and having to go through the process of contacting doctors for resident reviews, etc. There was a bonus here. I'd never worked in an area that had up-to-date policies and procedures before, all laid out for you, so that was a real bonus. And I would guess I've got used to it over the 4 years that I've been here now. There is a lot more probably paperwork involved than there was at the DHB, and I'm not as clinically able to work as what I was up there.
Right.
So that's been a change.
And that's because of all of those management functions that you have to fulfill as well?
Yes, absolutely. Yeah. So
you put Colette into a senior role. She's an enrolled nurse and reports to you, so you work quite closely. What was the situation that prompted you to look at having Colette as an enrolled nurse perform the care coordinator role for you?
So the clinical nurse manager that was here when I first started, she probably resigned about 10 months later. And we advertised, tried to recruit another, and we had 2 RNs here that at the time that had come from the DHB that weren't interested in stepping up into a management role because they were at the end of their careers. So I went to one of our board meetings and discussed with the board that we had Colette here, who was an enrolled nurse. She's very capable, and why not put her in that position? So that's what we did, and that was probably 2-3 years ago.
And did you discuss that with the DHB at the time, just to see if they were happy?
I had to. So what I had to do to make Colette the care coordinator was contact the DHB and they told me that I had to tell the ministry about the new role of care coordinator, and they told me that I had to be the clinical nurse manager.
Yes.
So I had to notify them of that.
Yes.
Yes.
So in effect, Colette works under your supervision and delegation, but she
Yes.
also works quite autonomously.
Yes.
Within that.
She does.
Yeah. So from your perspective, what's been the benefit in having Colette as the enrolled perform that role? How has it made an impact or difference with the healthcare assistants and the registered nurses?
So Colette, I recognised early in my first time here that Colette had the potential to step up into a management role, because she knows all facets of the aged care facility here. She's very clinically sound, excellent assessment skills and critical thinking skills. She's a great resource person for the staff and the RNs as well. They come to her for advice. And if she's a bit worried about anything, Colette will come to me and we'll discuss and work out a plan how to manage any issues that need sorted. Yeah.
Right, right. So looking at the aged care sector and what's happening with a crisis really in our workforce and a shortage of registered nurses, what do you see the opportunities for enrolled nurses in the future working within the aged care sector in New Zealand?
Well, I think there's the potential for them to have a career pathway within aged care. I would welcome employing enrolled nurses. We are actually having students in the facility. We've been having them for the last 2 years. And I think it's great benefit. They could be trained up. They're a regulated body. They've got a scope of practice, and we could really train them up.
Absolutely.
Yeah, like a new grad program or something when they first start, to put them on that career pathway if they're interested in aged care.
Exactly, because there's a lot of opportunities. I mean, we know that aged care is a growing need in the sector. We've got a growing population of older people, and you know they are going to need a certain percentage is going to need residential care.
And I can also see the RN availability dropping off because we've had international nurses. We've been using them in the facility for 3 years, even though they don't stay too long. I can see now with the border restrictions that they're going to dry up.
When you say, sorry to interrupt, when you say they don't stay too long, where do they go or what?
So they barely stay a year. I don't think I've had any stay for a full year. I had one that left while she was still orientating at 3 weeks, and they go to the DHB because of the pay.
So they get paid more at the DHB?
They get paid more at the DHB, and that's more attractive to them.
And this is the real challenge, isn't it? Because a lot of these nurses have come from overseas with debt that they've taken out to come here, and some are sending resources funds back to their families.
Yes.
So we can understand that pull. And so I think, this is definitely recognised very clearly. And I know with discussions at the New Zealand Aged Care Association, they are lobbying very hard to try and get pay parity. And this is why it's so important, because otherwise these nurses are not going to be available to the residents in aged care services that absolutely need them. We talked before about the increase in the number of hospital level people, and certainly the acuity, the clinical needs and demands do require that advanced complex nursing care that a registered nurse provides. So it's vital that we get that. Today is
Yes.
budget day, and we're very much hoping, fingers crossed, I haven't heard anything yet, that it would be nice to see that that is recognised and we get some increased funding, and that pay parity is listened to and addressed.
That's right.
So, look, thank you very much. Is there anything else that you think, Rose, would be beneficial in letting others out there that are looking at how they're managing their staffing and how they look at the combination of staffing skills that they've got to best meet the needs of the residents? Is there anything else that you would suggest to them in relation to how they can bring enrolled nurses into the team and support them?
Well, I think the first thing I'd say is look in your own backyard and see if, you know, who's got the potential to step up, you know, enrolled or RN, and set them on a pathway.
So that was your phone, Rose, and that's the nature of work in aged care services.
Yes,
constant interruptions.
Yes,
and,
yes, absolute.
That's just the way it is.
Yeah.
Look, I know you're a very busy lady, and thank you very much for your time today. That's been very much appreciated.